Thanks, Frans. And this symposium is about advanced imaging. And if you're talking about advanced imaging, you should make sure that your presentation is pretty advanced as well. So I'm using Keynote. That's the reason why I changed to a laptop, which is a bit of a struggle always, but it gives you really, really nice imaging. The other reason why I'm here is that probably most people immediately think about mobile C-arms if you talk about advanced imaging, and I'm here to convince you of the opposite. Mobile C-arms are actually quite advanced at the moment, and you can do almost all even complex procedures with C-arms as well. And not everybody can afford that nice hybrid OR that Frans talked about. I have the lucky circumstance to actually have both. So we have a hybrid room and we have C-arm. And we use it both for almost all procedures, not all, but almost all. And I'll tell you that it's really a pleasure to work with the C-arm as well. There is a few disadvantages, and there's definitely a few advantages of it as well. I'll come to that. Mobile C-arm in surgery or in the OR actually goes back a long way. Philips was the first to introduce it, so they have lots and lots of experience. This is the first one on this photo, and I'll show you that it looks a little bit different at the moment. So there's this widespread idea among many physicians that the images from a mobile C-arm are quite poor, and that most vascular procedures cannot be done with a mobile C-arm, and that working with a C-arm is quite difficult and frustrating due to communication problems with the technician handling the C-arm, and I'm sure that most physicians are kind of aware of this. That's all a little bit different with the newest C-arm from Philips. It's called Verhagen, and it was really built with one thing in mind, to make it easier to use for both parties, so the technician as well as the surgeon. It's all about easier workflow and easier communication. I'll explain to that. And as you can see, it really looks different from the ones that I just showed you, the first ones. First of all, you have this laser aiming device, which is really quite handy because you can actually see on the patient where you're gonna put the radiation beam before putting radiation to the patient. This is how it looks for real. So it's really clearly visible, and it saves you at least radiation. Nice tool. What I particularly like is this iPad-like tablet that you can use for all the gadgets that are on it. And it's what we call foolproof. It's really extremely easy. You start off just pushing the program that you like. So if you do bones, you do orthopedics. If you like vessels, you're doing vessels. If you like other stuff, abdominal, thoracic, there's different programs pre-programmed in it, and you just push that button and you don't have to do anything at all. It's the ideal setting then. It used to be a bit of a struggle to turn the image, and you ask your technician, can you turn it clockwise, and it's always the other way around, or it's just a communication problem. That is much easier because you can do it with a fingertip. Extremely easy. Here you can see a movie where you use the collimation. And again, extremely easy. You do it with your finger, just like on an iPad, and it works really well. Another source of frustration, if you want the technician to change the C-arm, say in LAO, RAO, craniocaudal, stuff like that, then you ask, can you put it to LAO and just unlock that handle? No, the other one. You know what I mean, right? So that has come to a stop now because they have color coding. Really easy. Just say, just unlock the red one, and you can do the rest yourself. Another thing to improve communication is something called Clear Guide. What it basically is that it has clock positions on the screen. 6, 3. Which makes it easier to communicate. So you don't have to ask a technician, can you put it south, north, west, up, down, which is kind of a struggle always because you never know what someone means. You just say, just push it to 12 or push it to 6. And it's on the image intensifier as well, of course, so it's easy to see, and it's almost impossible to have miscommunication with that. Something that used to be only on fixed system now is also on mobile systems. So it has a position memory, which makes it really handy to come back to your original position and to make sure that you don't have to do other angiograms or more imaging than absolutely necessary. What I particularly like is this outlining system. It works with either a stylus or a mouse or your finger on the screen, whatever you like, whatever you prefer. So you make your angiogram and you draw on the screen and it stays there. It's really, really handy. I'll show you a little movie where it's done here. So you see this angiogram and the technician just puts the stylus, or you can do it yourself if you like, to make sure that you, in this case, don't cover the renals. Like hybrid ORs, you have a wireless foot switch, and also all your imaging at the end of the procedure goes wireless through Wi-Fi and is sent to the PACS. So let me just show you this quite challenging case that I did quite recently on the Philips C-arm. So you have your angiogram, you see the both renals coming up. You just use the outlining facility and make sure that you don't cover the renals. You just slowly start to deploy. You see all the markers in line, and you don't want them crossing the renals, of course. Halfway through, you decide, well, let's make another angiogram to make sure that nothing changed. So you do that again. It's really quite good imaging, as you see. It's not really different from any other hybrid supersonic system. Same for the blowback, for your internal. You just draw it and make sure that you don't cover it. Probably one of the major advances, the major pros, if you compare it to a fixed system, is the amount of radiation that you use. It's really, it's probably cut in half, and sometimes you only use 1/10 of the amount of radiation. I know that for a fact because I work on both systems. And of course, you can't do the same procedure in one patient in two different machines, so it's difficult to compare, but the amount of radiation used with this C-arm is really a lot less than with fixed systems. So in conclusion, a mobile C-arm can actually give you superb imaging with very low radiation settings. Positioning is much easier and communication much easier than it used to be. This intuitive user interface with this tablet-like simplicity works really well. Vessel outlining is a nice gadget that will come in handy for many vascular surgeons, and the wireless foot switches is really handy as well. So if you compare them, pros and cons, it really depends on your local situation. It depends on how many people and how many different specialties have to work in this particular room. How much money is available in your specific hospital, in your medical system, if it's possible to buy a hybrid room or not, because whether you like it or not, it's very, very expensive, and you can buy 4 or 5 C-arms for one hybrid room. So it really depends on where you work. Flexibility is, of course, maximum with a C-arm, because you can just push it in and out of the room and go to another room or whatever. So that's a pro, of course. So it probably increases the efficiency of the whole theater complex. It has the lowest radiation dose for sure. And again, if you have budget constraints, and who hasn't, it may be a better choice. Thank you so much.